screw this up. Thank you.
Rachel, no worries. So welcome again. As I was saying, my name is Ilana. I'm a member of the Jewish Voice for Peace Health Advisory Council Steering Committee. We're really looking forward to spending the next hour together. We have been hosting these webinars about every 1 to 2 months since the genocide in Gaza began. And we're really grateful to you all for continuing to join us. For those folks who are new here, we hope you continue to join us at our future webinars, which we will be sharing some more information about at the end of today's call. For today's webinar, which is titled Palantir in Our Hospitals, we're going to be exploring how the same company that is enabling Israel's genocide in Gaza and powering ICE's surveillance systems across the US, among many other horrors and atrocities, is now managing 1 in 5 US hospital beds. We are thrilled to be joined by a really incredible group of speakers from American Friends Service Committee, National Nurses United, and No Palantir in the NHS, who you will all meet shortly. And regardless of how familiar you are with Palantir, the next hour is really going to provide us all with an opportunity to deepen our knowledge, ask questions, and then learn about some actions that we can all take today. So we'll hear from our speakers for about 35 or so minutes, and then we'll have time for all of your questions. We ask that you please use the chat function at the bottom of your screen during the presentation and during the Q&A to type in your questions for the speakers, and then we will read them out during the Q&A portion. And we kindly ask that you stay muted at all times during today's conversation and also keep your questions on topic and respectful. As you have probably already gathered, today's webinar is being recorded so that we can have folks tune in afterwards and also access all of this great information. So if you would like to change your display name or anything else you'd like to do knowing that it's recorded, please feel free to do so at this time. We'd like to thank all of our co-sponsors for today's webinar, including Science for the People, Boston Workers Circle, JVP Academic Council, People's Health Movement, and Massachusetts Physicians for a National Health Program. We'd also like to thank Doctors Against Genocide and Americans for Middle East Understanding for their publicity support. And before we get started, we also want to take a moment to honor the heroic healthcare workers in Gaza who continue to care for their communities day in and day out under truly incomprehensible conditions, and all of those who have lost their lives doing so. Today, in particular, we want to lift up Dr. Hussam Abu Safia and all of the Palestinian healthcare workers who are illegally detained by Israeli forces. As many of you know, after more than 18 months in detention, Dr. Abu Safia's life is in imminent danger. We're going to be sharing a couple of links in the chat from Doctors Against Genocide and Institute for Middle East Understanding Policy Project, where you can learn more about Dr. Abu Safia and other healthcare workers imprisoned and take immediate action. So with that, we are going to introduce each of our amazing speakers and dive in. So our first speaker is going to be Kenny Morris. Kenny is a campaign strategist with American Friends Service Committee's Action Center for Corporate Accountability. He supports campaigns against companies that profit from borders, including the global campaign against the surveillance company Palantir Technologies. Before joining AFSC, Kenny supported Connecticut tenant unions as the community engagement coordinator at the University Network for Human Rights, and earlier organized with coworkers in the logistics industry to win safety protections at their facility in his hometown of San Diego. Thank you so much for being here, Kenny. And after Kenny speaks, our next speaker will be Lily Kane. Lily is an educator with National Nurses United, the largest union of nurses in the United States. She has worked in the labor movement for a decade, previously working as an educator, researcher, and organizer with various labor organizations in California. At NNU, she has led education for union members on the impact of AI and big tech in healthcare and how workers can fight back using collective power. and she is based in the Bay Area. So welcome and thank you for being here, Lily. And our final speaker will be Dr. Rhiannon Moranian Osborne, a representative from Healthcare Workers for a Free Palestine and MedAct, organizing groups that are part of the UK's No Palantir in the NHS campaign. Thank you so much for being here, Rhiannon. And with that, I will hand it over to Kenny to get us started.
For joining today. Today I'm going to talk a little bit about Palantir and what this company actually is, and then talk a little bit about how we can get it out of our healthcare system. Again, my name is Kenny Morris. I'm a researcher at American Friends Service Committee and campaigner focused on Palantir. And Alana's right that Palantir has been spreading into our hospital systems here in the US and internationally in the UK, which we'll hear about. And that's the same technology that's being used by the Israeli military in their genocide in Gaza. I don't think I have to tell the people here this, but the genocide in Gaza is really an AI-powered genocide. There are algorithms that are choosing which buildings to bomb and who lives and who dies. And Palantir is a key partner in this. They signed a strategic partnership right once the genocide began, but they've been working with the government of Israel for a long time. It started in 2015, where this software it was used to track Palestinian social media to draw connections between them, to try to surveil and incriminate them. Later, their software has been used to plan raids in Gaza during the genocide, as well as was used to plan the illegal beeper or pager attack that killed and injured dozens of civilians, thousands of civilians. And not only that, this company, they're very proud of what their software does. They have had their board meetings in Tel Aviv. They have taken out one-page ads like this one, once the genocide began, saying that Palantir stands with Israel. And their CEO is very outspoken. They even said at one point, they agreed at one point that their software kills Palestinians. So that's the same company that is being used in our hospital. It's the same software that's being used in our hospital. And it's what the company executives have said is that 21% of the hospital beds in the US are managed by Palantir software. That includes 4 national networks, 4 regional networks, and across 46 different states that we know of. And what does it do? What does Palantir do in these hospitals? It largely falls into these 4 categories. It's that the AI decides which beds patients are placed in. It's also the AI designs staffing and scheduling, which we'll hear more about from our friends at NNU today. And also these last 2 that I really want to focus on about AI drafting communications with insurance companies and AI analysis of patient data. I want to focus on these because that concerns some of our most sensitive data. When they draft communications and they're talking between insurance companies, it's when an insurance company, they send a bill to the hospital, and so it's an automated response that will be sent back, which is good that the staff are able to focus more on their work. But the issue is that Palantir's AI is then having access to some of our most sensitive data, like our name, our addresses, our family sometimes, and often our social security numbers in these communications. And then AI analysis of patient data. In some cases, like in the Hospital of Special Surgery or in HCA healthcare, what Palantir is used for is also to scan nurses' notes or any medical workers' notes to digitize them, which means that Palantir, what's running through the system is some of our sensitive data about our bodies and what's actually happening in these hospitals. And at the heart of this really is that the same AI company, the same AI algorithm shouldn't be both in the Israeli military and in our hospitals. And which is why I want to focus a little bit on New York City's public hospitals, because that story really shows to me that we can win. What happened there is that New York City public hospital system is called New York City Health and Hospitals. nobody knew about this contract, actually. It wasn't on Palantir's website, it wasn't on the New York City website or any of their procurement databases. It was nowhere. And we were looking for different local contracts, and so we submitted dozens of FOIAs across the country, and including one to here, which uncovered a multi-million dollar contract that was hidden from the public. We found that New York City Public Hospital System was using some of these same AI services from Palantir and had paid them over $3.8 million for the time that they had worked there. So much money, so much taxpayer money. And so what we did was we took that information and we did some further research into it and gave that research to the community groups on the ground, thinking about New York City for Community Change, the Climate Organizing Hub. Um, and these are groups that have deep connections and deep organizing happening in the city. And we also gave it to a journalist. The Intercept, we gave it as an exclusive and showed light really on this contract that they had been trying very hard to conceal. And with the help of the community groups, they started putting pressure on this contract. They went to their city council, they started an inside outside strategy, and because it's a public hospital system, the CEO of New York City's public hospital system is actually beholden to the city council. So just months after the organizing began in this meeting right here, one of the city council members, they asked directly to the CEO after we had already been organizing, and they said that they were going to commit to not renewing the contract with New York City's public hospital system and Palantir. So they were dropping the contract and they were not going to let Palantir stay in our hospitals, following again all the organizing that had happened. I'm happy to talk more about this, but I think that this really shows that when we put pressure, when we come together, we can win and we can get Palantir out of these hospitals. One more resource that I'm going to drop in the chat is this map too. Because wow, it's fantastic, and we're so excited about the New York City hospital win. There are many more hospitals which we're going to hear about, and we need to start putting pressure. We need to come together as with your groups and with your organizations to start putting pressure on these, and start winning in other places too. Like I know we will with HCA, like I know we will with the NHS. So, again, I'll put this map in the chat to see where Palantir is for you. And I'll also put a fact sheet that AFSC and Popular Democracy we wrote together, really outlining the expansion of Palantir in our hospitals. But with that, I will pass it to Lily.
Thanks, Kenny. That was great. Let me just share my screen. Excellent. Okay, yeah. So that was, I think, a really important intro. I really appreciated some of learnings about some of that as well. So NNU is involved in this fight because we know that there are 15 hospital systems across the United States that use Palantir to manage hospital beds, automate staffing, communication with insurance companies, et cetera, all of these things that Kenny and Alana said already. And of those 15 hospital systems, NNU represents nurses at Maine Health and HCA, which is the Hospital Corporation of America. And there are also hospitals such as Cone Health in North Carolina that has a relationship with Palantir. Cone Health is not a union hospital, but it was recently acquired by a Kaiser subsidiary. Kaiser is, if you're especially in California, a major hospital system with NNU members across California, and they're branching out to hospitals across the country. So nurses know that this fight is one that really affects them all, even if Palantir has not yet reached their system. But between these three systems, HCA, Kaiser, and Maine Health, NNU represents over 35,000 nurses. So they're really in a strategic position to fight back against their employers' schemes to use AI to understaff as much as possible, and to ultimately purge Palantir from hospitals and stop its expansion into new ones. So like Alana said, Palantir manages 1 in 5 US hospital beds. In the US, the healthcare industry makes up 1/5 of the nation's economy and generates 1/3 of the world's data. So this is an incredibly lucrative industry for tech companies to be getting into, and 15% of Palantir's commercial revenue actually comes from the healthcare industry. As a union, we are taking on this fight because we know that these surveillance technologies have no place in our hospitals. But beyond that, we are opposed to the technology that they have developed for use in the genocide in Gaza, where over 1,500 healthcare workers have been killed, as well as for use by ICE to terrorize immigrant communities here in the United States. Beyond that, Palantir has also received data to develop tracking and surveillance systems technologies from ICE. And that data is actually partially the result of an agreement between ICE and the Centers for Medicare and Medicaid Services, which includes the personal data of nearly 80 million Medicaid patients. So by giving Palantir access to all of this data, the healthcare system has been effectively weaponized against patients. And we've seen the impact of this in hospitals across the country. Nurses have said that they witness patients delaying necessary care due to not wanting to enter the hospital and risk being targeted or detained. They've seen a worsening of treatable infections, a loss of limbs, and other increased health issues. We've also heard terrible stories of brand new parents giving up guardianship of their newborns to other family members, or even parents getting deported on the way home from the hospital. So all of this can be linked to Palantir's engine of surveillance and repression, and NNU nurses are actively fighting back against it. So NNU's major corporate campaign is targeting Palantir and through them HCA. So HCA operates 190 hospitals at across 19 states and the UK and employs more than 100,000 nurses. In 2023, they launched a program designed by Palantir called Timpani. So just to give a bit of background, we know that in general, units are grossly understaffed across facilities. While the media has taken to calling this a nursing shortage, it is actually a manufactured staffing crisis. So currently, there are over 1 million registered nurses with active licenses in the United States who are not employed as RNs, which indicates that the shortage is not of nurses, but of safe nursing jobs. Nurses are leaving the profession in droves because employers continue to find ways to undercut, devalue, and de-skill RNs, especially through the use of technology. One example of technology that's contributing to short staffing is staffing models that use AI to calculate staffing needs. So Timpani is an AI-driven software that HCA has implemented at almost all of their facilities over the past year, and according to nurses, has worsened staff retention at many facilities. The way that it works is that nurses are forced to download an app onto their personal phones or log into a website and input data about themselves, including their education level, what credentials they have, their years of experience, etc. Each month, they are allowed to choose 4 days that they want to block off, and the rest of the days, nurses are either scheduled to work or are listed on the schedule as neutral, which basically means they can be moved around to work on those days if hospital needs arise. So essentially, nurses have control of 4 days of the month, and HCA controls the rest. Now, HCA claims that this software is supposed to help staffing by ensuring an even distribution of education, skill level, and experience across all shifts. But of course, nurses who have experienced this app tell a very different story. Many have taken to calling it a short staffing app, and overall, nurses have said that they are more likely to work understaffed shifts since Timpani was introduced. And ultimately, this is driving even more nurses away from the bedside and leading to worsening patient care. Nurses have also said that tympany has also been used in a punitive way. So this app tracks things like clock-ins and clock-outs and marks tardies, absences, late calls, and early releases. HCA has a system that assigns points to workers in the app. For example, half a point if for a late arrival, 1 point for leaving early, even if it's an approved release by a supervisor. And HCA uses these points to automatically discipline healthcare workers and nurses once they reach a certain threshold. So that's 4 points for an official warning and 8 points for termination. And this is because at the end of the day, tympany is a powerful piece of surveillance technology. Now, union nurses have, of course, the bargaining power and have bargained over these kinds of processes, but we know that they can be used for retaliation against union leaders and as a way to intimidate non-union workers and effectively quash boss fights. To quote one HCA nurse, morale is super low because everyone is on the verge of being fired all of the time. Palantir is using tympany to automate staffing, which is putting patients at risk and creating unsustainable schedules for nurses and overall further perpetuating the hospital-made staffing crisis. HCA has claimed that tympany has eliminated over 90% of the administrative burden of nurse scheduling, but in talking with nurses about their experiences using the app, it is clear that the software simply just doesn't work. So Palantir has no place in our institutions and no place in our hospitals. With the broad partnership that HCA and Palantir have together and using AI to lean staffing to the bone, we have a real opportunity to use our industrial power to get Palantir out and to raise the profile of HCA's understaffing blueprint. As healthcare is a huge part of the economy and a huge source of data, working to prevent Palantir from expanding in hospitals is crucial. So at Mission Hospital in Asheville, North Carolina, which is an HCA facility, they have used their collective power already to stop HCA from adopting tympany. We also have a big pressure campaign against HCA to get them to stop using Palantir in their facilities. And have protested at the annual Frist Gala in Nashville, Tennessee. The Frist family are the founders and board members of HCA. And we also have a letter campaign to CEO Sam Hazen demanding that they end their contract with Palantir. Nurses in Maine have also been putting up a fight against Palantir, and hopefully they'll get some inspiration from the New York City campaign. Nurses have found out that Palantir was operating in their health system, and the union has sent an official request for information. The health system has refused to give any information about what Palantir does at Maine Med, but union nurses and allies are continuing to fight. Along with our allies in the Purge Palantir movement, we are pressuring the board and demanding that they end their contract as well. We're also mobilizing with direct actions hosted by allies in these movements and with our own internal education work, including connecting hospital fights to Palantir's support of ICE and genocide in Gaza. Along with our allies, we've successfully gotten U.S. Representatives Ro Khanna and Mark Jacobs to return their political donations for Palantir, and we're continuing to put pressure on all elected officials who have received Palantir contributions. As far as we are concerned, Palantir has blood on their hands, and the hospital industry is colluding with them. So nurses around the country are putting their hospitals on notice that any contract with Palantir will be fought. And to end, since it's always important to hear nurses' voices, I just want to play a video from an HCA nurse speaking at an action with the Purge Palantir Coalition in Palo Alto in February. And I really hope I shared sound. So let me know if I didn't.
My name's Blaine. I'm a nurse. And part of our training is to prevent harm from coming to people, to anyone, no matter what their immigration status is, no matter who they are. Alex Pretty, he was one of us, and he was murdered by ICE doing the thing that he knew was right, protecting his neighbors and his community. Palantir uses its surveillance software to target our neighbors, our communities. And we're not going to let this happen anymore. We need this company out of our government, out of our hospitals. And we're here to make a difference. We're here to make our voice heard. And I want every one of you to know that as nurses, we will continue to fight for the rights and dignity of every human being on this planet.
So that's all from me for today, and I will pass it on to Rhiannon.
Thank you so much. Yeah, really, really nice to be here. I'm Rhiannon. I'm a medical doctor based in the UK, and one of the organisers of the No Palantir in the NHS in the UK. So the NHS stands for the National Health Service, which is the UK's national publicly provided health service that covers the whole country. It's one of the biggest employers in the UK and one of the biggest employers in the world, and holds possibly the most complete data set of anywhere in the world, because it has all of the health records of everyone who used healthcare in the UK since it was formed, I think, in 1948. So it's a kind of huge site of Palantir's expansion, which I'll go into. I don't have any slides, but what I'm hopefully going to do is talk through like a little bit, give a bit of background context around Palantir's role in the National Health Service and their expansion into the UK. Then I'm going to talk a little bit about the campaign that we've been organising now for about the last 3 years. But I won't go into too much detail, because I think what's more interesting is the kind of lessons from that campaign that are maybe transferable to different contexts. But if anybody does want to get like super nerdy about the details of the NHS software, I'm here if you want to do that afterwards. So as a group, Health Workers for a Free Palestine started in November 2023 in response to a call for solidarity from Palestinian health unions, who put out a call to disrupt complicity in our own institutions. And we formed as a group of mostly health workers, but what's interesting is that has also really changed over the years, and as more people have got involved in kind of health justice organising in general, and the Palantir campaign, which I'll kind of come back to. And basically within the same month, Palestinian health unions put out that call. Palantir announced that they were advancing their strategic partnership with the Israeli occupation forces, and the UK's National Health Service announced one of its biggest data contracts, I think its biggest data contract in history, with Palantir, worth 330 million UK pounds, for Palantir to build and manage a new nationally managed health data system for the purposes of kind of analytics planning. So that basically all happened within a month. As a group, we were like, okay, I guess that will be our focus for the rest of our couple of years then. So then we chose Palantir as a target, but one of the things I think that is important to know about this target is obviously there was this timing and context that set out that being a target, but the intention was always to choose a strategic target that set a precedent. So even though it's a very targeted campaign around, in particular, one particular company and one particular contract, the strategy and the aim has always been to set a couple of precedents. So those have been to hinder Palantir's expansion in the UK in general. So the National Health Service is not the only government agency where Palantir has a contract with. They also have a huge, I think it's about £240 million contract with the UK military, and are also rolling out surveillance services across UK local police forces across the country. But the choice of this contract is both, it's one of the newest contracts, so one of the ones that's least established, both in terms of its legitimacy, but also in terms of the software itself. And also it's the institution where we thought we would most be able to organise workers, and especially organise workers around the human rights abuses that Palantir is so deeply involved in, and one of the UK's biggest institutions to generate outrage around, because people feel very strongly about the National Health Service. And so it was a strategic target in terms of Palantir's expansion in the UK in general. It's also a strategic target from a BDS perspective. There are other companies who are deeply involved in the Israeli state and with the Zionist occupation in general, that are really embedded within the National Health Service, one of them being Oracle, Larry Ellison's company, who provide a lot of the HR systems within the National Health Service. But they are a harder company to organize against because their software contracts are more spread out. This is like a single contract, which you can target. Oracle's contracts are more like localized and individual, and they're much, much more embedded. So like a much harder target to actually remove from the health system, whereas Palantir's software is both brand new to the NHS and, as we'll come on to, very helpfully shit. So in terms of strategic targets, in terms of establishing the precedent that UK public bodies, especially the health service, should not be giving huge contracts to companies involved in a litany of human rights abuses, Palantir is also a strategic target from that perspective. And it's also a strategic target from the practice of outsourcing in the public sector. So even though the UK has a publicly funded and publicly provided National Health Service, which is obviously great, and was the result of really hard union organising. There's a really interesting story about the origins of the NHS in a kind of union-run workers' collective health system in Wales. But anyway, I won't divulge. I won't go into too much detail on that. But the NHS is like, it would be very unpopular politically and almost impossible politically to privatise the NHS officially as a UK politician. But what you can do is sell off huge chunks of the NHS to the private sector. And this is happening kind of across public services in the UK, especially after decades of austerity where those public services are seriously underfunded and kind of failing. That gives the government more excuses to hand huge chunks of those public services to the private sector in what we call outsourcing. So we also wanted to establish the precedent that actually you should not be outsourcing essential public functions to massive tech companies, and that these are functions that should be run in the public interest and in the public good. So that was about nearly 3 years ago, and we started off as a fairly small group, and we are now probably about 50 national organisers and 23 different local campaigns across the country. Multiple government committees have recommended that the NHS contract be cancelled. It's kind of hanging on by its last thread, and we're kind of in a very hilarious media tennis match with Palantir at the moment in the UK press, which I think we're winning, which is nice. And hopefully the contract will be cancelled, but I think there's some organising and campaigning lessons from the last 3 years that are hopefully helpful to people doing Palantir organising or any kind of big tech organising wherever you are. So I'm going to speak about those. But yeah, as I said, if anyone has any more questions about the detail of the situation with the National Health Service, very happy to answer those. So I think the first lesson, which I think the other speakers have alluded to how important this is understanding the software. So Palantir sell essentially snake oil. They sell like a load of different AI tools and softwares kind of packaged under their company, and with a load of consultancy services and a load of people to come in and kind of help organizations plug that data into the Palantir software. In the UK context, this software was really presented as a miracle software solving the problems that are objectively caused by the underfunding of public services. So in one hospital, which we then worked on exposing, so one hospital claimed that Palantir had reduced their waiting list by a third, which is literally unheard of. Like, these are waiting lists, these are years-long waiting lists that are long because there's like a chronic shortage of resources for the services, a lack of doctors, a lack of nurses, a lack of administrative staff to support those clinics. And suddenly this hospital out of nowhere claims that Palantir has reduced its waiting list by a third and produced some kind of like miracle that without adding any more staff to the clinics has reduced the waiting list by a third. And basically, Palantir software was and is still to some extent, but less so, being presented as some kind of mysterious miracle that we'll never be able to understand, but is somehow going to solve all of our National Health Services problems. So we spent quite a lot of time actually understanding the software, what it does, what it offers, what it can do, what it can't do. And that has helped us in two really distinct ways. So the first one is the organizing strategy, which I'll talk on to later. And the second thing, which has been a big wing of the campaign and a really important lesson, I think, for us, has been our investigations wing. So as a campaign, we have had like an investigative arm of like grassroots researchers for like the whole time we've existed. And what that wing of the campaign has managed to do is expose multiple things. So it's managed to expose that the software is actually pretty shit, which is nice. It's a big win for the campaign in the sense of we still would have done this campaign if the software was really good. But it is obviously very helpful that software is bad. And actually people really, really hate it in terms of the quality of the data analysis that it produces. And so we've been able to produce investigations that challenge this narrative that it's this like incredible thing that's going to save the National Health Service. The investigations wing has also done a lot on exposing conflicts of interest. So that same hospital where a third of where they claimed that the waiting list had dropped by a third, the chair of that hospital's board was at the same time the chair of Palantir's Health Advisory Committee. And that hospital has remained kind of a Palantir darling. And a member of Palantir staff is an innovation advisor to that hospital. And the conflict of interest also runs at the national level. We've seen multiple senior executives from the National Health Service very quickly get jobs at Palantir quite soon after the contract was awarded. And yeah, we've been really also interrogating these benefits claims. So we've been doing research that shows that actually that waiting list didn't even go down. And where on earth that, and like we'd have no idea where they got that number from, because the actual statistics show that their waiting list has continued to rise. And we've not been the only ones investigating the benefits claim, so definitely wouldn't be taking all of the credit for this. But after basically the claims about the software being some kind of, as someone has seen in the chat, kind of fountain of youth for health services, have been so publicized and so embarrassing that the National Health Service is now under investigation by a government watchdog for publicizing misleading information about the software and how many lives it saved and how many operations it's done. So that's kind of the one lesson, is understanding the software and not falling for the kind of like snake oil PR that lots of these big tech companies, not just Palantir, sell. And then the second thing related to this, I think, is designing an organizing strategy that can disrupt the software. So one of the things that we learned about as part of this research was that actually, even though this was a nationally procured contract and local hospitals were told you have to use it, the software doesn't work unless each local hospital chooses to switch to it actively. So it means like moving your kind of, so say like your local hospital in Birmingham has to stop what it's using at the moment, say for managing discharges, and move its systems onto the Palantir one. So this creates a big window of opportunity for organizing, basically. So obviously, if every hospital in the country has to make this change, that also leaves every hospital in the country open to organizing from the community and the workers in that hospital to not do that, basically. So by understanding the software, we were able to kind of build an organizing strategy that targeted the more publicly accountable parts of the National Health Service, whereas the National Health Service executives at the national level are much harder to influence. Your local hospital is a lot more easy to try and hold accountable. And so now there's different worker and community campaigns. In some places, it's like entirely workplace campaigns. In some places, it's entirely community campaigns. In lots of places, it's a mix. And there's 23, 24 of those across the country now at the moment, basically lobbying their local hospital to not do the transition and to not support the transition to this national software. And then the second thing has been supporting the organizing of tech workers themselves. So public sector tech workers who are not only being asked to work on Palantir software, but are the people that could build and manage alternatives to that software and different ways of doing data analysis within the public sector. I think we were really inspired by colleagues in the US, especially in the National Nurses Union, to link the workers' struggles to the use of the software specifically. So in the UK, coincidentally, at the same time this national data analytics software has been introduced, there's been a 50% cut to administrative tech, data and digital professionals within kind of across the NHS as a whole at the national, regional and in some cases local levels. So we've been trying to link the fact that this software is being heralded as kind of like the catch-all can do all of your data analysis to the fact that data analytics and tech workers across the public sector are being kind of fired en masse at the moment. And then the third thing under the organizing strategy is that we've worked very closely with, but not been dependent on the health union. So there's a load of different health unions in the UK. There's the doctors union, there's nurses union, there's general public sector unions, which cover a huge amount of the health service. And as an organizing body, we have like sat outside and across all of those unions. We have members across all those different unions and have done organizing within each union without the campaign like depending on the union being able to move at the pace that we need it to move it to, because unions in the UK can move quite slowly and also not necessarily want to take huge risks, especially around a company that is like quite litigious. But through kind of like working really closely with those unions and organizing within them, that the support of those unions has then been instrumental to the campaign and has really strengthened the ability of workers to engage in the campaign, strengthened a lot of the national discourse and the national legitimacy around the demands of the campaign, and has enabled more like grassroots union organizing at the chapter level. So for example, the doctors union, which I'm in, doesn't actually technically have chapters. It's a very like kind of a top heavy union, if you like. And so like there's not as much kind of grassroots organizing that goes on. So we've been trying to kind of work with the unions, and lots of them have had like brilliant policy and brilliant statements nationally, and then trying to convert that into grassroots trade union organizing in different hospitals. So that's been a really like great and powerful relationship. And yeah, doing it across all the different unions has added a lot in terms of the ability of different workers to engage in the campaign. And then there's two more. I think the third one I would say is messaging militancy. So we have always had messaging that covers three different areas. So one is the fact that Palantir is a super evil company, and their role in the genocide, their role in the ICE deportations, and saying that like as health workers, we don't want anything to do with a company whose other operations are mostly death, deportation, and destruction. So establishing the kind of the ethical precedent. The second has been around surveillance. So obviously pointing out, as Lily has already talked about, the link between health data and deportations in the US, and basically explaining how this software makes that kind of work more feasible in the UK. And I think what was really interesting was when we first started talking about this, some people were like, oh no, you're scaremongering. And actually my background is in like migrant justice and healthcare as an organizer. So there is already some data sharing between the UK's Home Office and the hospitals, but it is at the local level. So each hospital like sends a report, and that itself is really damaging. But it's quite hard for the national government to access data on a national level because all data is held in the different local hospitals. And what this software does is it massively increases the amount of patient information that's held on a nationally accessible software. So we were making the argument that this increases the capacity for state surveillance within healthcare. And then people were like, oh, you're fear-mongering. And then somebody put that to Palantir in an interview. And then Reform, one of the far right parties in the UK, said, yeah, if we get into power, we're going to copy the US. We're going to make an ICE-style surveillance system that combines data from all of these different government departments, including the National Health Service, the tax authorities, basically doing a copycat of what's been done in the US. They were very inspired by it, and said, we'll do this. And someone put that to Palantir in an interview, and they said, yeah, if they were democratically elected to do that, we'd do that. So it went from being something that we were saying, okay, this could make this more easy, to then being like a very on paper kind of proposal from one of the parties, with Palantir saying they would comply. And we've talked about how that negatively impacts patient trust in the health system as a whole, and will lead to people not presenting to healthcare and not sharing their data with the health system because of the surveillance operations of this company. And then the third one was, as I've touched on, the outsourcing and privatization and the workers' rights linked to this contract. So we've stuck to all three of those pretty militantly for the last 3 years, and basically shot down a series of their arguments. So we established Palantir as a terrible company with like horrific human rights abuses. And yes, I can wrap up in the next minute or two. And then they said, oh, but like all the companies are evil. Nobody actually really cares anyway. And then actually we established that thousands of people across the country care, and everyone made complaints to their local hospital. And all of the local hospitals were under huge like fire from their local communities for this national issue. People were really worried about the surveillance capacity. And then the NHS and Palantir said, okay, so lots of people care. But actually, our software is like the best thing for the NHS that's ever existed. So even if we are a super evil company, even if the surveillance risk is really bad, like, is it not just worth it to solve, the waiting issues of the NHS? And then we put out loads of stuff to establish that they were basically lying about that, and that the benefits claims are kind of really not based on any fact. And then then they've had to retract some of those claims, and the only thing they've got left is, oh well, there's no alternative to this software and it's too embedded now. So anyway, and they're about to lose that argument as well. And the final thing I would just end on is that I think the reason why the campaign has been able to keep going for 3 years is because we've tried to very intentionally develop internal structures that support care and learning. And I won't go into those in loads of detail, but maybe for another day. Yeah, I'll stop there.
Thank you so much, Kenny and Lily and Rhiannon. This has really been such a tremendous learning opportunity for everyone, I think. Hearing about Palantir on a regular basis is remarkably disturbing and depressing and feels extraordinarily terrifying. And yet, whenever I've heard from you all or read about the work that you're doing, it really is incredibly inspiring to see how much you've been able to accomplish in such a short amount of time. And so just huge congratulations to you all, and to everyone doing this work every single day. We do have some time for a couple of questions. And I know that we have gotten a couple questions in the chat, so we can start there. Again, as a reminder, if anyone does have any questions, please feel free to put them in the chat and we will read them out. One of the earlier questions was about kind of interfaces or systems speaking to one another between data being collected in the hospitals and then data being used by ICE or CBP or in Palestine. And I know that Lily and Rhiannon in particular, you've spoken a bit to that, but wondering if anyone else has anything to add regarding to the ways in which systems are currently speaking to one another or may potentially speak to one another in the future.
I'm happy to start if Lily and Rhiannon jump in after. What we know that Palantir says is that there is a complete firewall. What they say is that there's a firewall between the data that's used in hospitals and to the data that's being used by ICE or the Israeli military. That said, we also know, like Rihanna mentioned, that there's flaws in the software. There's been cases where Palantir's software, specifically when it's used by police, has not been secure. Other people have been able to see that data, and it's sometimes it's been an issue. It's been an issue, absolutely. And that said, I mean, I think that again, the biggest concern is that one company really shouldn't be sitting at the nexus of all this information because it creates these kinds of fears and it creates these kinds of very valid concerns about if this company is holding my information about my social security number and also it's being used for ICE, it's being used by the military. How do I know that that's not being shared between each other, right? And one company really shouldn't be at the intersection of all of that. But Lydia, Rhiannon, do you have anything you want to add?
I mean, not a ton. I think the biggest issue that we see is that, with Timpani in the hospital, like we don't like nurses have no idea how their data is being used. They have absolutely no idea. Like, they just, they download an app onto their phones, which we encourage them not to do when we do education with them. But a lot of the times they just, everyone just clicks like I accept all terms just to like use the app to make it easier for themselves. But we don't know like the amount that like it's getting from phones. It's probably getting a lot of data from their phones. And there's just a lack of transparency from the hospitals around where this data is going, both with like nurse data and patient data. We know that Palantir is trying to create like a massive database of centralized data from like all sources. So, obviously one of the biggest issues is transparency and whether or not they're actually doing what they say they're doing. There is a bill in California that we're trying to get passed that would help improve, safe data privacy around technology that is used for medical purposes. I believe it's AB 1979 if anyone's in California. If it's not that, it's like 2575. I don't know. But these are really big, important things and questions to ask. So yeah.
Yeah, I think yeah, thanks both for I think just to jump in on the like data sharing and systems talking to each other element, I think it's helpful to think about the two different like types of data sharing that we mean. So I guess a lot of what Palantir does is actually stuff that governments want to do anyway, and Palantir software helps them to do that. So they want to do surveillance, they want to do deportations, they want to do AI-based warfare, and Palantir helps them to do that. So if a government like removes all of its data sharing restrictions, as a lot of US departments have done, then having Palantir in all your different departments then makes that much easier, right? So one US official said, I think it was to Business Insider, that when Trump ripped up various data sharing restrictions between different government departments, they said having everything already on Foundry made that much easier. Also, like something like that, basically, that the fact that all of these departments already had Foundry meant that when the government decided to end data sharing restrictions, that it was much easier for the government to use data in the way that it wanted for surveillance and repression. But I guess that's not Palantir kind of organically sharing that data with the different systems. That's like a state using Palantir software to share data, which is like what Palantir software kind of offers. It's not like they go in and make the government do something that the government already didn't want to do. The state already wants to do these things, and then Palantir says, "Oh, we have this software that creates flashy dashboards that can help you do that." And then the second thing is like data privacy within like Palantir systems themselves. And I think just like thinking of those as like slightly different things. So in the UK, for example, like one of the biggest things that Palantir has done in the press is say like, oh, these campaigners don't understand our software. Palantir don't own the data. We won't share it outside of what the NHS tells us to. They're just scaremongering. So we actually didn't say that you own the data, because that's not how Palantir operate. They don't like sell data on your behalf. What we have said is that it enables the government to do more state surveillance, and it benefits Palantir as a company as a whole. So the fact that they have all of this health data, or could have all of this health data, means that they can improve their software, which they can improve Foundry in general, and that is the same software that's used to kill people and deport people. So those are kind of the different arguments that we've made.
Thank you so much for that. That's super helpful. I know we don't have a ton of time left, but I did want to kind of highlight one other question and build on it regarding understanding the Palantir software, getting access to it, learning from it, kind of digging into it. And also, we've mentioned a couple different softwares today, like Timpani and Foundry. And so I just wanted to kind of broaden the question a little and ask you all a little bit more, to speak a little bit more to the fact that there are all of these different Palantir softwares. And Kenny, I know that the fact sheet that you shared has information on what those are, just so folks have a little bit more sense of potentially what to keep an eye out for, what to look more into in their own systems.
Yeah, I can put it in the chat. We have a fact sheet. Copying it in right now. Where you can read through it, and if you're looking for Palantir in your hospital, it says the software names that Palantir has designed for hospitals that we know of. I'm sure that there's more, and this is not an exhaustive list. These names, I'm sure they change as well. But this is based off of the company's presentations and the hospital's presentations when they're talking about Palantir software. So if you scroll down, I believe it's a couple pages in, there's a short list if you're looking for Palantir in your hospital. But again, thinking of the best way that you can know and fight back against these contracts is by getting together with your unions, by getting together with your organizations, and really diving into this as a group and collectively.
Yeah, and just to jump in quickly on something that I have seen in the chat that's related to this question of what software do they offer? Like, if you get rid of Palantir, what's to stop the next AI data sharing platform from stepping in? I think that's a really good question, and I think that's why like building campaigns that, as everyone has done, like establish like delegitimize the precedent of whether that be like using AI to like monitor workers in the workplace or having partnerships with companies involved in human rights abuses in general is really important, because the other bidder for this national the two final bidders for this national health system contract in the UK were Palantir and Oracle. So if we say, oh, don't give it to Palantir, give it to the other person that bid it, the other person is Larry Ellison. So it is not like a strategy for just to say like, oh, Palantir is bad, but everyone else is okay. But it's because Palantir are such an exemplar of like everything that AI powered surveillance can do, and how violent and also politically powerful those companies are, to use the campaigns to set that precedent, basically.
Yeah, I also want to piggyback off of that. There was a question earlier about like whether we can use Epic systems, which is a major electronic health record system, like charting system, kind of has almost a monopoly in the United States, as like a bulwark against Palantir. And I would say no, because Epic is not necessarily doing the same human rights abuses across the world. But they are also understaffing. They are also, automating nursing care. They're, really a system to control how nurses do their work. And this is creating, a system in the United States where nurses are, kind of have to listen to what the software is saying. And the healthcare industry is kind of being automated in favor of profits. So they are still a billion-dollar company that is using the hospital industry to make money rather than actually improve care. So yeah, there are technologies that can be used to benefit healthcare, and we don't deny that, but we can't just switch to another one just because it's not committing human rights abuses.
Thank you for that. That feels like a great note to end on, but I hate to end it because there's so many great questions and there's so much we could keep talking about today, but want to be mindful of everyone's time. So we will close it out now. We have just a couple of important announcements before we wrap up. First and foremost, just again, huge thank you to our speakers, not only for being here today, but for all of the really tremendous work that you're doing, and how much energy and how much of yourselves you're investing in this, and we're lucky to be able to learn from you. So thank you. We'd invite you all to visit jvphealth.org to sign up to receive our regular urgent health updates on Gaza and the West Bank, East Jerusalem and Lebanon, as well as announcements for future webinars and other important action items. You can also visit jvphealth.org to sign up to join one of our working groups if you're interested in getting more involved. We do have a newly formed Palantir working group that will be meeting in the coming months to continue building our work in this area. We'd love to have you all join us. So again, head over to jvphealth.org if you're interested in joining that or any of our other working groups. Our next webinar in September will feature Laith Malhis with the Al-Shabaka Palestinian Policy Network, who will be speaking on dehealthification, Israel's engineered collapse of Palestinian life. We are currently working on finalizing the date, and we will share that as soon as we have it, but that will be in September. And then finally, before you close your computers or move on to the next part of your day, we just invite you all of us here, to take at least one of the actions that was shared by our speakers today. We will put those in the chat once more. There are a number here, and continue building this collective momentum that we all have. So with that, thank you so much for being here. We really appreciate it. Take care, and we look forward to seeing you again soon.